years, more and more focus has been placed on how loneliness and isolation not only impacts overall wellness in the aging population, but also whether these factors actually increase morbidity, especially along the lines of chronic disease. Oh, people can be isolated but not feel lonely. And on the other side of the coin, they can feel lonely and not at all be isolated. So the question that needs to be answered is whether the perceived quality of relationships or the quantity of social contacts matter more. So the researchers of the study define loneliness as unhappiness with social relationships and social isolation as having few social contacts. And according to Valtorta, Cannon, Gilbody, and Hanratty, there are three pathways that have been defined that associate social relationships with an increased risk of cardiovascular disease. And those are behavioral, like smoking or physical activity, psychological, like low self-esteem or self-efficacy, and biological, meaning their response to stress, their allostatic load, or their cardiovascular reactivity. Now, this study included over 5,000 men and women over the age of 50. They were studied for a period of about 5.5 years, and they were asked different questions throughout different waves of the study. And this part of it just focused on loneliness. So one wave included just one agree or disagree statement. Much of the time during the past week, you felt lonely. And then during other waves, the researchers would use a set of 3 questions that focused more on frequency than intensity of the feeling. And those questions were, how often do you feel lack of companionship? How often do you feel left out? And how often do you feel isolated from others? Now, the researchers focused on 6 social isolation factors and assigned a point to every factor that applied to each individual person. And those factors were living alone, less than monthly contact, either face-to-face or through social media or on the telephone with their own children that live outside of the home, less than monthly contact with other relatives living outside of the home, less than monthly contact with friends, no participation in any organizations like church or community, and then if they're not currently employed. So the researchers also included aspects of the Framingham study and accounted for age, HDL, total cholesterol, systolic blood pressure, smoking, and diabetes. Now, during the study, there were 571 first-time cardiovascular events reported. So as you'll see here, the results of the study show that people who reported weaker social relationships, meaning loneliness, were 29% more at increased risk for heart disease and 32% more increased risk for stroke. So the Framingham factors had absolutely no association. Loneliness remained an independent prediction of risk, and additionally, social isolation was not associated with any disease incidence. So this study shows that quality over quantity really does matter. So what needs to happen now? Medical providers should consider a patient's perception of social relationships. Loneliness can help identify cardiovascular disease risk when other traditional factors aren't present. And quality of relationships rather than quantity of contacts can provide more insight into a patient's overall wellness. And so just like Valtorta, Cannon, Gilbody, and Hanratty said during this study, highlighting an individual's loneliness could be the first step in preventing the development and worsening of other risk factors for CVD.